Today, we're going to talk about something that's way more common than you might think, but is also really misunderstood, and that's post-traumatic stress disorder, or PTSD.
But before we get into all the official definitions, let's just start with a simple question, one that gets right to the heart of it all. What happens when a memory just won't go away? You know, when an event was so intense that it just keeps replaying, messing with your life right now. That's really the core of what we're going to unpack today.
All right, here's a quick look at what we're covering. First, we'll define what post-traumatic stress actually is. Then we'll break down the 4 main ways it shows up. After that, we're going to bust some common myths, look at the very real paths to getting better, and finally, we'll talk about how you can be a good support system for someone who's going through it.
Okay, let's jump right in. Part 1, what exactly are we talking about when we say post-traumatic stress?
So at its core, PTSD is a mental health disorder. It's a condition that can show up after a person experiences or even just witnesses a really frightening, dangerous, or shocking event. It's basically the mind and body's way of responding to an experience that was just too much to handle.
And what kinds of events are we talking about here? Well, the list is pretty broad. It could be anything from a serious car accident to abuse or violence, to living through a natural disaster or being in combat. It can also come from something like the sudden loss of someone you love. The point is, there's no single type of trauma that causes it.
Now, this is a really important point to get. Not everyone who lives through a traumatic event will develop PTSD. A lot of people are able to recover over time, especially with help from their friends and family. It's when that natural stress reaction just doesn't fade away that it can turn into this disorder.
So, if it doesn't happen to everyone, how does PTSD actually show up for the people it does affect? What are the signs? Well, the symptoms generally fall into 4 main buckets.
Let's break these down. First up, you've got intrusive thoughts. This is when the trauma just forces its way back into your mind. We're talking flashbacks, nightmares, stuff like that. In response, a person might move into avoidance, where they try to stay away from anything and everything that reminds them of what happened. Then there are the mood changes. This can look like feeling numb or guilty or just losing interest in things you used to love. And finally, there's hyperarousal. This is like the body's alarm system is stuck in the on position, so you might be easily startled, feel irritable, or have a really hard time sleeping.
And we're not talking about minor annoyances here. The impact of these symptoms is huge. They can seriously get in the way of school, friendships, hobbies, pretty much everything in a person's daily life.
Now, because PTSD can be so complex, there's a ton of bad information out there. So let's do a little myth-busting and separate what's true from what's just plain wrong.
Okay, so a huge myth is that having PTSD is a sign of weakness. The fact is, it is a medical condition. Trauma can literally change the stress circuits in your brain. Another myth, that it's just overreacting. Nope, it's a real brain response to an overwhelming event. And finally, there's this idea that it means someone is unstable. The truth is, PTSD is someone has. It is not who they are. It doesn't define them.
All right, we've covered the challenges, so let's pivot to maybe the most important part of this whole conversation, hope. Let's talk about recovery, because there are absolutely effective, proven ways to treat PTSD.
And let me just say this as clearly as possible. If you take one thing away from this, let it be this. PTSD is treatable. Getting better isn't just possible, it's what happens for so many people who get the right support.
So what does that treatment actually look like? Well, it's usually a combination of 3 main things: getting professional therapy, sometimes using medication to help with symptoms, and learning new coping skills to manage daily life.
Therapy is really the cornerstone here. There are specific kinds that work really well, like trauma-focused CBT, which helps you change unhelpful thought patterns about the trauma. There's also exposure therapy, which is a safe, guided way to gradually face the things you've been avoiding. And then there's EMDR, which uses things like eye movements to help your brain reprocess the traumatic memories so they lose their power.
And along with therapy, there are other tools that can be a huge help. Sometimes doctors prescribe medication to help with things like anxiety or depression. But things you can do yourself are just as important, like getting regular exercise, working on a healthy sleep schedule, and practicing mindfulness and breathing techniques. All of that plays a massive role in recovery.
So where do we fit into all this? What's our role? How can you be a trustworthy and genuinely helpful friend or family member to someone dealing with PTSD?
Okay, let's get practical. Here are some simple do's and don'ts. Do listen if they want to talk.
but don't ever push them for details. Do be patient. Recovery takes time. Do keep inviting them to do things, but don't take it personally if they say no. And a really important one, do encourage them to get professional help. On the don't side, never say things like just get over it. And please, don't try to expose them to their triggers, thinking it'll help. It won't. And remember, your job is to be a friend, so don't try to be their therapist.
And this next part is a really big deal. It's non-negotiable. If you're ever worried that someone is in immediate danger or might hurt themselves, your job is to get help right away. Contact a trusted adult, a school counselor, or call emergency services. Your safety and their safety has to come first.
I really want to end with this idea because it's so important. For way too long, people have thought that asking for help with your mental health is a sign of weakness. But the truth? It's the exact opposite. Realizing you need support and taking that step to get it, that is one of the strongest and bravest things a person can ever do.
So a PTSD diagnosis is not the end of the story. It's a chapter, for sure, but it doesn't get to define the whole book. With the right treatment, with compassion from the people around them, and with their own incredible strength, people can and do heal. They rebuild their lives and find that feeling of safety and control once again.